as a fill-in chair, we have Mary Lane from Carroll County until our chair from Baltimore County arrives. So I turn it over to the chair. Madam Chair.
And welcome to the first meeting of the year. It's great to be here in person. This meeting is being recorded. If anyone online experiences any difficulties, please send a message in the chat box. If any members are participating virtually, I ask that you turn on your cameras during the roll call for attendance as well as for voting. I ask Rebecca to start the roll call to determine member participation.
Annapolis, Anne Arundel County, Baltimore City, present. Carroll County,
Here.
Howard County, Queen Anne's County, MDOT.
Here.
RTA of Central Maryland. MDOT MTA. Present. Maryland Department of Environment. Here. Maryland Department of Planning.
Good morning. Happy New Year here online. Sorry.
Thank you. FHWA.
Present.
Thank you.
Thank you. Our first item is the approval of minutes from the December BRTB meeting. Has everyone had a chance to review the minutes? If so, can I have a motion and a second to approve the minutes?
Anne Arundel motions to approve. Harper seconds.
Anne Arundel moves, Harper seconds. Are there any edits from the members? Seeing none, we'll now vote on the approval of the minutes. When your name is read, please indicate aye or nay.
Annapolis, Anne Arundel County.
Aye.
Baltimore City,
Aye.
Baltimore County. County,
Aye.
Howard County, Queen Anne's County, MDOT,
Aye.
RTA of Central Maryland. Thanks, everyone.
Okay, the minutes are approved. The next is our public participation opportunity where we offer the public a chance to speak to this board. If anyone has comments on any of the action items, please wait for that item to be discussed. If there's anyone who wishes to address the board at this time, please indicate in the chat box.
Madam Chair, we did have a member of the public who requested to speak. Right now, we'd like to ask whether or not they would like to speak during this portion or whether or not they would like to wait for resolution 25-19. Indicate so in the chat box, please, or speak up.
Yeah, if it's possible, I would like to speak to that, but I'd like to do it, during this portion if I can. I can't stay for the entire meeting.
You could state your name again, Michael, please.
Sure. It's Michael Sapanik. I'm with Baltimoreans for People-Oriented Places.
Okay. Again, please try to keep it to 3 minutes or less as possible, please.
Sure. Thank you, Todd. Yeah, good morning, everyone. I'd like to comment on Resolution 2519, the updated highway safety performance targets, specifically the number of non-motorized fatalities and serious injuries. So obviously the numbers aren't good and the upward trend is awful. As the resolution states, both the BRTB and MDOT, they maintain their long-term commitment to achieve 0 deaths on the states and regions roadways. But this, this one-liner feels like really a hollow hearts and prayers statement absent some more substantive response. And this resolution, it feels more like the continuation of an annual goalpost moving exercise to avoid committing to any adequate, real needle moving measures that will reverse the upward trend of those deaths and injuries, much less get us to 0. And I know that's not the intention of everyone here, but that's just the way it comes across with this statement. So the numbers are stark, and the 2030 goal is to be 4 fatalities in industries above the number from 20 years prior. So we really haven't made any progress. So what I suggest is that the BRTB and or MDOT commission some sort of analysis of what measures we would need to take to actually hit an aspirational target, whatever that be. And I don't believe such an analysis has ever been done. And just knowing what the solution looks like, I think would be immensely helpful. And I'm aware of MDOT's revamped complete streets policy and quick build initiatives. Those are fantastic steps. And I commend those steps. But to move the needle, those measures and measures like them need to be amplified quickly, 100-fold. I also suggest that MDOT and other regional transportation departments adopt the crash analysis studio model that Strong Towns has been developing, demonstrating, and advocating for over the course of the past year or two. They recently issued a report, Beyond Blame, How Cities Can Learn from Crashes to Create Safer Streets Today. And the report identifies several key factors contributing to traffic accidents and highlights the lack of institutional mechanisms for making the necessary changes that could save lives. And that's the completion of my statement. Thank you very much for the opportunity to speak.
Madam Chair, we have a second member of the public who would like to speak. Ms. Carolyn Carey, please. You could unmute yourself, please.
Yes,
Nope.
I just did. Okay, I'm new. I don't know very much, so that's why I'm here to learn. But I did notice in Resolution 2521, I saw something that seemed quite familiar to me in reference to the RAISE project for Righteoustown Plaza and what you guys are going to be doing there in terms of Complete Street. And so in February of 2023, I was supporting the RAISE project of Mondawmin, and that project was approved for over $20 million. My question with these, and it's, Mondawmin is not related to Righteoustown Plaza, but maybe you can help me. When does the public hearings start on the hearings on these projects?
Madam, we are going to have a presentation on that resolution, so hopefully we can try to address it during that resolution. Would that be okay?
That would be fine with me. Thank you.
Okay. Chair, currently we do not have anyone else from the public who is requesting to speak during the public participation opportunity. We would like to ask to skip item number 3, come back to that in a little bit and move on to the report from the technical committee if possible.
We now ask for a report from the January meeting of the technical committee from Mr. Dan Jansen.
Morning. So it's a very short report. The technical committee met on January 3rd. But I'm sorry, the technical committee meeting on January 3rd was canceled due to snow event. There were rules if the Baltimore County schools are closed, the technical committee meeting would be canceled. So we did take an online vote. Baltimore Metropolitan Council sent out information to us, and the technical committee voted to endorse all 3 of the action items today on the agenda. And so that concludes it. The presentations that were going to occur on January 3rd will happen at the later.
Well, let's see, looks like our chair has arrived. So Mr. Chair, we had a fill-in for chair. And now the next action item, we've temporarily skipped the report on public comments. If we could move on to item number 5, the report from the interagency consultation group, please. Would you like to call for the report, Mr. Chair? Yes. Okay, Miss Anna Marshall from BMC will present from the ICG. Anna, could you take it over, please?
Yeah, good morning, everybody. The ICG met on Wednesday, January 8th, which was the first meeting since July. And this was to kick off the next round of transportation conformity. Recently, in August, the Baltimore region was bumped up to a serious non-attainment area for the 2015 ozone max. And this is because the region didn't meet the standard by the attainment date. And for some context, the BRTB is responsible for demonstrating conformity with the mobile emission budgets in the state implementation plan. And this was demonstrated last year as part of the 2025 to 2028 TIP. And the reason that we were bumped up is because there's other sources of ozone pollution besides mobile emissions, which contribute to the region not attaining the standard. And this could also be due to the Canadian wildfires from the summer of 2023, among other factors. But we are working with MDE to sort this all out. And also in December, EPA released the MOVES 5 model to be used for state implementation plans and transportation conformity. There's a grace period to use it of 2 years, so it doesn't have to be used until December 2026. And during the meeting, ICG discussed the draft methodology and assumptions letter, which lays out the methods and models to be used for this round of conformity. The final draft will be discussed at the next ICG meeting in February. And my colleague N. Damazia also presented information about the 2 TIP amendments that you will be hearing about today. And ICG determined both amendments to be exempt from air quality requirements. And the next ICG meeting is February 5th. And that's all I got. Thank you.
Very good. Now we're going to move on to Monica. She's going to give us a report on public involvement.
Mr. Chair, unfortunately, Monica, we're going to give her just a moment to get ready, and if we could move on to the resolution.
She's ready.
Oh,
I'm
you
sorry,
okay,
she's right
Monica?
here.
Okay, good, great. Hold on 1 second while I pull up the report, please. Yep.
Good morning.
Morning.
Nice to see everyone in person. So this is the public involvement report. I'm reporting on things that were happening in December. We're really excited about the project that we launched related to the upcoming long-range transportation plan. It's called What If, and we were looking at the future and where are we going to go and imagining what if. So that ran through December 15th. We had over 2,000 people look at our project website, and of those folks, 659 people participated. That's almost a 30% participation rate, which we think is really great, and it's well above the average participation rate. We received over 1,000 comments. Over 382 folks subscribed to our mailing list. And in order to get the word out, we put a whole range of social media posts out, and we sent out over 10,000 emails. In terms of geographic engagement, we were really pleased that we were able to get participation from all over the region and even down into the Washington area and up towards Philadelphia. Folks even participated, so we may have gotten commuters from those areas. We were excited to get help with getting the word out. Queen Anne's County, for example, had an announcement right on their homepage and shared information. We got a shout out in the Baltimore Banner. There was an article about the Bikeable Baltimore Region project that we're working on, and there was a mention at the bottom of that article about the What If project, so that directed traffic there. Also, we got some really great traffic on X. We had a just elected city council member that posted it, and that really drove a lot of traffic. There was over 10,000 people who saw that post. And so that kind of word helped us really get the word out to a lot of people we may not have reached otherwise. So there were a lot of really great tweets that helped us get the word out. So we're excited about that. In terms of the Patapsco Regional Greenway Stony Run project, we have had a community meeting on December 11th at the Severn Library. That was great. We had about a dozen people who showed up and talked with us about the project. In terms of the Stony Run engagement, we had nearly 2,000, we had 1,909 people view our project website. 74 people participated, 78 comments, and nearly 30 people subscribed. We sent out about 2,000 emails to get folks, and again, we had 12 meeting participants. The top 5 conveniences, features that people wanted to see on the trail is beautiful views, wayfinding signs, restrooms, seating, and trash cans. We are really excited to report that 84% of the people were happy with the trail location that we chose, and that was based on public feedback. This was phase 3, so we have been working since last January and building up public awareness and interest and getting their feedback. So some of the comments you can see, I can't wait to use it. I love the consideration. Thanks so much. So we're really excited to get a lot of positive feedback from folks. Only 4% said they weren't happy with it, and there were some comments, and we can follow up and address some of those. The Bikeable Baltimore Region project was really successful. We went out with phase 2 of this project. The first phase was a listening phase. This is a proposing phase where we had a proposed bike network. We had 6,687 people visit the project page, and 429 folks participated, 172 comments. We had 2 community meetings. We did 11 presentations. There were 113 people that participated in the in-person and virtual meetings combined. We also got out in the community. Staff did pop-up outreach events. We were at Hopkins School of Public Health last week. We were at other, like a senior center also. We did handlebar interviews in the community. So we really went out and got the word out and talked to people in the community about what's going on. So I think that led to the success of getting over 400 people to share their comments. Again, those are some pictures from the meeting. The in-person meeting was at Baltimore Unity Hall, which was a really great space, and there was really great interactive discussion, and people were writing notes on the map and stuff like that. So it was really great. We've also been spending time connecting at local community meetings. We have various staff that go to different events. So these are some of the events. We've been to some bike ped open houses, the Bay Bridge open house that was virtual, so these are just some of the things that we're participating in as staff, and to make sure we're aware of what's going on and to be there as a resource if needed. Also, we are going to board and commission meetings and professional meetings. So these are some of the events that we were involved in December. I and another colleague had a great meeting with the Chesapeake Potomac section of the Institute of Transportation Engineers, otherwise known as CAPSITE. We're talking to them about potentially partnering to do some sort of event with their members to get the word out and educate them on what we do and how they can get involved. We were involved with Maryland Trails Advisory, Anne Arundel County Transportation Committee, and their Bike Ped Committee. And so again, these are some of the commissions. If there are board and commission meetings you want us to attend, or other events that we can be out and about and meet folks in the community, please let me know.
And thank you for attending our commission.
Thank you so much. Thanks.
Good. Thank you, Monica. We're now going to move along to our action items. Todd, could you please introduce the action items?
Certainly. Presentation up first. Today, the BRTB is being asked to consider Resolution 25-19. This resolution is to endorse updates to the 5 highway safety performance targets. Ms. Cindy Birch from our staff is going to provide some information on this resolution. Cindy?
Thank you. Good morning. Happy New Year. With the new year comes safety target.
Happy New Year.
Thank you. So I'm just gonna go through this. I know you guys already have the information in front of you, may not want me to just talk about numbers nonstop for 10 minutes, so I won't do that. But just wanted to give you a brief overview of where we are, what's going on with safety. We heard from Michael Sapanik earlier, some of the concerns. As of now, we have some preliminary, we're still calling them preliminary, I believe, 2023 crash figures. They haven't been quote unquote closed out quite yet. There are still some crash reports coming in. The good thing is we now have public access to crash data through the Maryland State Police, so we can see as they change. I believe, and we're gonna hear a little bit later from the director of the Highway Safety Office, I believe we're close on finalizing the numbers for fatalities. We're just waiting for other crash reports that are under investigation to come in. So you can see up here for 2023, overall, sorry, this way. So we have our region up on the top half and the state on the bottom. 2023 was an increase year. The preliminary numbers I was just referring to for 2024, they came back down a little bit. So I'll talk about that a little bit later, but what we're here to set targets with, unfortunately, is just through the 2023 data, because those are fully closed out and finalized, and that was an increase year when it comes to fatalities and injuries. So overall, for the last 5 years through 2023, our region is in blue at the bottom and the state is red on top, following the same kind of trend lines as them. Unfortunately, like I said, we had that slight increase. It'll look better next January. I promise it's gonna come back down. This is our serious injuries. That's another metric that the feds want us to report targets on, and that's basically an incapacitating injury. It is a determination made by the officer responding to the crash. It's not a clinical identification of injury level, but it's things unconscious, visibly deformed, broken bones, things like that, or that would have a serious impact on someone's quality of life. And then another metric that was referred to earlier is this non-motorist fatalities and serious injuries. So this is looking at both of those metrics, but just among pedestrians and bicyclists and those outside the vehicle. So you can see we had an increase from 2022 to 2023, unfortunately, in those numbers. But when we break them out to see, okay, so we're putting fatalities and serious injuries together, what's the actual trend within that number? We can see that unfortunately our fatalities did go up. It's the yellow bar, the smaller yellow bar, and our serious injuries went up. That's why we had such an increase from 22 to 23. But we can also see that just the proportion of those figures that are serious injuries, so they're still living individuals, even though they're significantly affected, and the numbers of fatalities. Sometimes when we put them together, we'll see like back in 2019 and 2020, we had a small dip in the total number, but we actually had a few more fatalities. So we wanted to break it out so nothing is kind of hidden within that total. And this is just to let you know, as far as our region as part of the state, looking at that, we're roughly half of everything except their fatalities, which is good. So we have about half of the crashes, serious injuries, and total injuries. About 46% of the VMT are within our jurisdictions, but only 40% of the state's fatalities on average are. So that's some little brighter spot to it. We don't want any fatalities, of course, but we do have fewer than one might expect, considering how much of the VMT and exposure we have. So for you guys, for today, for what the board, we're asking the board to do, it's in federal regulations that we set targets every year. We have 3 months or 6 months after State Highway submits their targets in the Highway Safety Improvement Program reports. So we have until the end of February. We've been doing this. This came into effect back in 2018. At that time, the board opted, there are two options. One, to adopt the state metrics and their targets, or two, to set our own. So back in 2018, the board opted to use the same methodology to set the targets, but to make them our own targets for our region. So we're not adopting a state target that takes into account everybody outside of our area. So that's, we choosing to follow along with the state. What the state uses is an exponential forecast in 5-year rolling averages. So that way those individual spikes kind of get evened out a little bit because the numbers can change so much. So taking 5-year rolling averages, an exponential forecast from back in 2005 to 2009. And this is the state meeting their federal requirements, so it aligns with us doing it. If there's an increase, which unfortunately we do have with the non-motorist, we apply a 2% annual reduction because we always want to set positive targets to aim for. We don't want to project and set a target for more fatalities and serious injuries. We want to focus on bringing it down. So there's 5 targets to set, and we shall look at them now. So just looking at the last couple of years, this is what's in the resolution. You can see these are our 5 targets: fatalities, serious injuries, each of those per VMT, so we can have a rate, and then the non-motorized fatalities and serious injuries I just showed. So you can see between 2022 and 2023, unfortunately, we went up in fatalities, we came down in serious injuries, and the rates showed the same trend. And we did go up in non-motorized serious injuries and fatalities together. That was a significant jump there. Again, like we saw, driven by a lot of the serious injuries, but also an increase in fatalities. So for this one, when we looked at the overall 5-year trend, like I said, of the rolling averages, the non-motorized fatalities and serious injuries was the only one that would project a higher number if we extended a trend line. So that one did get a 2% annual reduction, so that we always have a target to strive for. So these are the targets that are set up, and we have a 2030 goal. These are all set statistically and based on data so that we know what we're working with, and we can set targets that feel more achievable. Our goal is always going to be 0. Our vision is always going to be 0. We're the only vision 0 state by legislation. But to go from 252 to 0 in 5 years is kind of, it's hard to grasp and get your head around. But if it's like, let's bring it down to 220 or to 219, you know, we're still striving for 0. We're still trying to prevent all of these fatalities and serious injuries, but it's a little easier to wrap our head around, if that makes sense. And then at the bottom, just to show you the same years for our VMT. So you can see our VMT is rebounding from the pandemic when it dropped so much. And we're back above the baseline numbers. So just for reference, I apologize to our state partners in the room. All of their numbers went up from 2022 to 2023. So we at least had our serious injuries coming down in the region, but their figures went up as well. They had a significant bump up in fatalities from 566 to 621. So before I get to the current update, are there any questions about these numbers? They reflect all crash reports all across the state. Everybody uses the same electronic platform to turn them in, so the data quality has improved significantly over the years. It's state roads, local roads, all agencies. Any questions? Okay. So then real quick, before I get away from the data, to let you know, this is as of, is that today? Yesterday did this. So like I said, we have public access now to data as the reports are approved. And state police does have a dashboard online. This is the address for a fatal crash dashboard that is hosted on the Highway Safety Office website. So you can see Baltimore County. You guys are awesome. You came back down from 91 to 70 thus far. I did check with a partner in the county police. They said they don't know of any outstanding fatality reports, so hopefully that number doesn't go up much. Hartford County, you guys came down quite a bit, cut in half. I also checked it with a partner in the sheriff's office. He said the same thing. As far as he knows, all the reports are in. Queen Anne's County, I know they're not here. They came down. So my personal theory, my Cindy theory, not BMC or anyone else, is that 2023 might be our odd year. And we're coming back down in 24, a little closer to what we had before that whatever the reason may have been, something for us to figure out that 2023 really jumped up. You can even see in the region and the state, we're coming back down so far preliminarily for fatalities. And then just my last little piece, what are we doing about this? We know it's terrible. Some of us are afraid to drive sometimes on the roads because it doesn't seem always so safe. We're trying to do a multifaceted approach. We have things from our TIP and our long range plan with our goals and our ideas. We have complete street policies. We're going to hear about the state's update to theirs. We work very closely with them with their vulnerable road users assessments, and our congestion management process has a lot of safety put into it. We have all of your local strategic highway safety plans, all of you have out there. And also you've all been getting funding from Safe Streets and Roads for All to different degrees to implement those plans. We have the Look Alive campaign with Signal Woman. Hopefully everyone's very familiar with. She is still going. And branching off of that, we're developing a hyper-local safety campaign. So this is through you, through the board, through our UPWP. We're working here internally to get out things in your lots, to get them on those buses, to get them out into your local community newspapers or digital resources or things like that, to really try to get to people at that level to complement what the state and the national media campaigns cover. And then all the wonderful public engagement needs to continue to expand that. And if you have any new ideas, feel free to let us know. We do still have dashboards up. Charles Baber here updates those every month on our webpage. There was a change in crash reporting. That's why there's two of them here. There was a change in the structure, but they both have the same metrics and the same categories. So you can use that as you see fit. And I wanted to just give a shout out to Annapolis and then also Baltimore City, getting Safe Streets and Roads for All funding this time around to do work for their local safety plans. That's all I have.
Cindy, I appreciate this report. I have a follow-up question.
Okay.
With the data dashboards and the level of granular data we have, the locations of crashes, is there a way to do like a ranked list of top intersections and roadway segments? Like, would their proportion be higher on like a 97 or 695, or, you know, that would help us create a responsive, targeted either enforcement or engineering set of program and projects to alleviate the amount of crashes we're having here.
And actually that's that's a great idea and a great question, Sam, because the topic has come up around here a little bit too. If we want to make a regional high injury network where we could do like State Highway does, where they do segments or intersections and identify the top ones. I know some of you have high injury networks within your local safety plans within your jurisdiction, but there's been some questions, should we do it even as a region to roll them together? So no, that's a great, and you're right, we can do that because we have that information now. And the crash data are available in this format back to 2018. So we can even see how things changed through and since our pandemic effect. So thank you.
Do you also get the fatality reports to determine if it's something that might have been driver error?
The crash reconstruction reports, no, we don't get those. We could work with the police agencies. Right now, they're not standardized in the same format. There's the same information is captured by all the different agencies, but they have different formats and they're not electronically maintained. So I believe, I won't speak out of turn, I think we'll hear about it in a second. There is a project going on at the state level where they would like to work with all of the agencies that do crash reconstructions to find a way to make them more available and make them more standardized. So, but we could on a case-by-case basis work with the police department.
Thank you.
Thank you.
With that, we're reminding that we do have a presentation on the Maryland Vision Zero Commission coming up a little bit later, but meanwhile, we do now ask the BRTB to consider resolution 25-19, setting highway safety performance targets.
And now I ask for a member to move for approval of the resolution.
Anne Arundel motions to approve.
And is there a second? Does any BRTB member have any questions or comments? on
Mr.
the
Chair,
safety performance
yeah,
numbers?
we do have a hand raised from our representative from the Maryland Department of Planning, Behoy. Would you like to?
Yes, thank you, Todd, and thank you for the time. And looking at the data and I'm sure that everyone's concerning about, especially for the non-motorized rates and all that. It is a good idea, I think, to get into the details about where those accidents happen and in which other geographic region. Are they concentrating in urbanized area or in the rural area? And what is the major cause of that? And so you can have a different strategy. And especially when Maryland are growing more compact, our data show, and more dense. And then at the same time, we also encourage people biking and walking more. So it is very important to address this safety issue, and especially if people walk more, and then if any condition there is prevent them to do so, that will dismiss our effort of encouraging people walking and biking more. So I do think the region should conduct some sort of analysis in depth, and along with the statewide effort. And then since we're going to hear the presentation later on from the committee to join into that issue more. Thank you.
Great, thank you for that comment and suggestion. Like I said, we've batted the idea around a little bit. I haven't submitted a formal request of our UPWP to do it, but I appreciate the support I'm getting from all of you in the room to do that, and on the phone. Thank you.
That's great.
If any member of the public has any questions or comments, please indicate so in the chat box. Todd, has any member of the public asked to speak?
Mr. Chair, currently there is no one requesting to speak in the chat box.
We will now proceed to the vote. Again, if you're online, turn your camera on. When Rebecca reads your name, please indicate yay or nay.
Annapolis. Anne Arundel County.
Yay.
Baltimore City. Baltimore County.
Yay.
Carroll County.
Okay.
Harford County.
Yay.
Howard County.
Yay.
Queen Anne's County. MDOT.
Yay.
RTA of Central Maryland. Thanks, everyone.
The resolution is now passed. Let's move on to the next action item, please.
Okay. Today, the BRTB is being asked to consider resolution 25-20. This resolution is to consider a request by the Maryland Department of Transportation State Highway Administration for one tip amendment for the area-wide carbon reduction project. Check and see if Mr. Ben Allen is online. Ben, if you're online, could you please unmute? Okay, we seem to might have technical difficulties with our representative from State Highway Administration. So I will go through the resolution, try to answer any questions if you have them. So this is an amendment to again add the area-wide carbon reduction project into the fiscal year 2025 to 2028 TIP. This is adding funding across the board from project planning, engineering, right-of-way, and construction funding. What is the area-wide carbon reduction program? This includes basically projects designed to reduce transportation emissions. It includes a number of different eligible type projects, from public transportation to congestion management to street lighting and other measures to reduce environmental and community impacts of freight. So the area-wide carbon reduction program in this tip is requesting the following types of funds. These are 80-20, so 20% local match. In the planning arena, about $1 million. In the engineering, 4.2 million. Right-of-way, 1.1, and the construction is $15.7 million. And the board had heard and made recommendations in this area months ago. And Ben Allen from the State Highway Administration is in charge of that project. But with that, we will turn it over to the chair and ask the board to consider resolution 25-20.
Thank you. Now I ask for a member to move for approval of this resolution.
And on the motions to approve.
And a second.
Norfolk County seconds.
Does any member of the BRTB have any questions or comments? We now ask that any member of the public online, please indicate so in the chat box. Todd, has any member of the public asked to speak?
Mr. Chair, currently there is no one requesting to speak on this resolution.
We'll now proceed to the vote. Again, if you're online, board members, turn your camera on when Rebecca reads your name, and please indicate yay or nay.
Annapolis. Arundel County.
Yay.
Baltimore City. Yay. County.
Yay.
Carroll County.
Yay.
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 Queen Anne's County. PennDOT.
Yay.
RTO Central Maryland. Thank you.
Resolution is passed. Next action item, please.
Today, the BRTB is being asked to consider resolution 25-21. This amendment is to consider a request by the Maryland Department of Transportation MTA for one tip amendment for the Reisterstown Road Plaza Metro Station Multimodal Access Project. Ms. Elizabeth Gordon is going to present on this resolution.
Hi, good morning.
Good morning.
So this tip amendment is a pretty standard action to obligate a grant. And in order to obligate the grant, we have to move the funds into the year of obligation. So that's what this action is to do. What the grant is this is a RAISE grant, and it is specifically a RAISE planning grant. So it doesn't have any engineering or construction funding. It's funding to study the Reisterstown Plaza Metro Station transit-oriented development and the complete streets considerations and elements around that metro station. We did have a question from the public earlier. That was, when will public meetings associated with this project occur? Those are not yet scheduled, and the reason they're not yet scheduled is because the grant agreement hasn't been executed, so the team can't start work until that money is executed. However, we do think this summer is a reasonable estimate of when those meetings will occur, and we will of course promote them. There was a similar question about when the public meetings for the Mondawmin RAISE project, when those would occur. We did do pop-ups related to that and stakeholder meetings related to that project in the fall, and those have informed a concept plan that will be presented to the public in the spring for feedback and changes to that plan based on input. So that's a little bit of a side, but I wanted to make sure to address the public question. So that's the request. This amendment will obligate $4.6 million in RAISE funds to fiscal year 2025. This is a 100% federal grant. That's because it's for planning efforts in what the federal government has designated a disadvantaged community. So there is no state match. So this is just moving the federal money into the year of obligation. We can kick off this project pretty promptly after the grant is executed, but of course not before. So that is the request. Our manager of Baltimore Planning, Jamie Richardson, is the point of contact for more info. But I am also happy to answer any questions.
Hey, Mr. Chair, before we take comments, we would like to ask the BRTB to consider resolution 25-21. Stay up here.
I will now ask for a member to move for approval of the resolution.
Anne Arundel motions to approve.
And a second.
I'll count a second.
Does any of the BRTB members have any questions or comments on this resolution?
Mr. Chair, we do have a comment or question from our representative from the Maryland Department of Planning. Please unmute.
Yes, Liz, thank you for the information. Is that money include the engineering and design?
No, I don't believe I'd have to review the scope to see how far we're getting, but this is primarily just planning that's getting.
Just planning. Oh.
Yeah, I'd have to review the scope to tell you the exact milestone, but it's planning, not.
Okay. Okay, thank you.
We now ask that if any member of the public has any questions or comments on the resolution, to please do so within the chat box.
Mr. Chair, we do have a comment or question from Ms. Carey. It is a question as it relates to the Mondamin Raise project. So it's not necessarily for this specific resolution and project, but Ms. Carey, if you could unmute and ask your question.
Thank you so much for this opportunity. You have no idea how much this weighs on my mind. Thank you so much. The lady who gave the presentation, I didn't get her name.
Hi, my name is
Gordon. I'm sorry.
My name is Liz Gordon.
Liz Gordon. I don't think I've spoken with you before.
Probably spoken with some of my team members.
Okay, and I will stay within 2 minutes. I'm concerned because of the pop-ups, and there's nothing wrong with that, but I think that there needs to be community engagement. Now, the Parkway community is within half a mile of the Mondamin hub. And so when we're talking about streetscaping and making the street sidewalks and all of that accessible to people with disabilities, I have a serious problem when I see a person in a wheelchair in the street. And because he cannot get off of the sidewalk. He can get on at one end of the street, but then at the other end of the street, he can't get off because there needs to be some type of a curb cut. Also, on the Mondamin side, across from where I live, tree roots have raised the sidewalk. I need, like I said, the pop-ups are okay, but there needs to be community engagement so I can make people who are working with that raise project aware. Within a half a mile, you may have a biker, you may have someone in a wheelchair, you may have somebody like me who utilizes mobile devices like a rollator or a cane, where the sidewalk is raised up because of the tree roots, and that will have to be repaired. And that was after I had a good section of it repaired 7 years ago. So there's another little situation there. So I'm just trying to employ the people who are working on this. I did I thought a wonderful letter of support for the Raise Project because I live near Mondamin. I also was a person who was able to get the curb cuts in Mondamin many years ago in the 1980s, and I know how important these projects are. But I feel like I'm being ignored because nobody answers the phone and return my call. And I really feel that you need to talk to some of us who are within a half a mile of the hub. There are a lot of organizations within a half a mile. Thank you.
Yeah, understood. So in addition to the pop-ups where we're reaching people on the site, we have done stakeholder meetings, community association meetings, but point taken that that outreach hasn't reached you yet. The effort in the spring is going to be a lot larger. So we have, every expectation that we'll be able to reach you at that time, where there's still plenty of time to bring forward those ADA concerns and the various access and repair and state of good repair things, which really are part of the intent of the project and are really important. I want to thank you for your letter of support, and I also want to thank you for the work getting curb cuts and ADA access in your
In
time.
Emerson Village, right. I've been participating in the raised project, Emerson Village, and I guess that's why they asked me to do a letter of recommendation when they were working with the bus project. So I've been around involved with this, and I just feel slighted. I see problems. I see a mother pushing a baby in a buggy in the street with a toddler walking on the sidewalk, and I'm wondering why. When I check, there's something wrong with the sidewalk. And so if I cannot convey that to you when you start doing the streetscaping, will we be left out?
Yeah, so access is fundamental, right? Like that's a civil
Yes.
and so within the scope of the project, you know, we'll be making the ADA improvements as much as is possible within the scope of the project. And
I thank you. You have my name, you have my number, telephone number. You know, I appreciate it.
if we had your contact information, so my team
Yes.
can make sure that you're heard between now and our next public input.
Thank you.
We really appreciate your
Thank you.
comment. Thank you for your time.
Thank you.
Thank you. And with that, Mr. Chair and Board, we do ask the BRTB to consider resolution 25-21. I believe we've had a first and a second, and we have no further people requesting to speak on this resolution.
We now proceed to the vote. Again, those board members that are online, please turn your camera on. When Rebecca reads your name, please indicate yay or nay.
Annapolis. Anne Arundel County,
Yay.
Baltimore City. Yay. Baltimore County,
Yay.
Carroll County,
Yay.
Harford County.
Yay.
Howard County,
Yay.
Queen Anne's County. MDOT,
Yay.
RTA of Central Maryland.
The resolution is now passed. Now on to the informational items. Todd, please introduce our speaker for today.
Mr. Chair and Board, today, Dr. Tim Kearns, the Director of Maryland Highway Safety Office, is going to present some updates from the recently reformed Zero.
Good morning, everybody. I think my voice will hold out for a few minutes at least. Thank you for the opportunity. Cindy showed you a lot of numbers, so I'm not going to show you very many numbers at all. I do want to kind of tell you where we are as we start 2025 and where we're heading for the next several years. So it's just going to be kind of a potpourri of highway safety. But if you have any questions, please let me know. I will start off with the one piece of data that I'm going to talk about. 573 fatalities for 2024 is where we are as of this morning. I know Cindy's chart at the bottom had 553. What's online, even though we do maintain a fatality website on Zero Deaths, and there's several other dashboards up there that have numbers on them, they are still all not as complete as they can be. We have 573 fatalities. What's on our dashboard does not include fatalities that occur on Baltimore Washington Parkway or other roadways maintained by US Park Police. They don't submit their crash reports directly to MSP. They don't use acres, so their forms are a little bit different, and we have to kind of bring them in separately. So there's always caveats when we show crash numbers and fatality numbers out there. So when you're looking for the actual number, please feel free to reach out. 573 is what the fatality analysis reporting system has for Maryland as of this morning. We do expect that to fluctuate a little bit, but it will be below 600 by the time we're done, well below 600. And it's good to see that we are back where we were in 2020, 21, and 22. Even though those numbers are still ridiculously high, they are lower than they were last year. So we did trend in the right direction for 2021 or 2024. One thing to point out, our percentage of pedestrian fatalities still remains about the same statewide. About 25% of our fatalities are pedestrians. That has remained unchanged. One thing that did change a little bit last year is we had fewer fatality crashes. So a lot of our fatal crashes were single fatals. So there's a little bit different numbers that we had several fatal crashes in 2023. The crash dashboard that I talked about launched at the Highway Safety Summit in 2023. It uses the MSP data warehouse as their source of the acres data. It's updated from 2026 to the present. It is updated daily. There are still those caveats. We do have those caveats on the website. So if anybody is curious about why numbers don't match, we try to make sure that we explain as best we can. The Strategic Highway Safety Plan, we are in 2025. The Strategic Highway Safety Plan expires in 2025. So we are going to spend the next year planning the next 5. There will be meetings over the month of February. The one for the Baltimore region is scheduled for February 19th at Baltimore Community College. We will have that information posted online. We are trying to have regional public input meetings, so we can have as much input in the development of the Strategic Highway Safety Plan as possible. For those of you that aren't familiar with the plan, everything we do under highway safety, whether it's under the Highway Safety Office or even State Highway Administration, has to fall under the Strategic Highway Safety Plan. The plan itself is actually a federal highway document, but we develop it at the Highway Safety Office in conjunction with our partners at State Highway Administration. So it is a comprehensive document. Everything we do for highway safety will be included in this plan. So if any piece that's missing in what we currently have for our emphasis areas, if there's any piece that's missing when we're talking about how we bring partners together, how we work collaboratively, how we use a safe system approach to address all of our highway safety issues, that is one opportunity to do that. That's definitely an opportunity for the public to get involved. There'll be a statewide meeting in April at the Secretary's office on April 15th, and lots of opportunities as we go through the spring to provide feedback and input on what our plan will look like for 26 to 2030. As you know, Maryland did pass some legislation in 2019, making us a Vision Zero state. 2030 is the year that legislation is looking for us to be at 0. I don't really realistically expect us to be there, but we have never been below 470 fatalities since we started tracking back in 1960, the late 1960s. I would like to get back in the 400s as we get closer to 2030. So anything moving in the right direction is certainly where we want to go. I'll just talk a little bit about some of our primary emphasis areas. Impaired driving obviously is a key concern when we're out on the roadways. Maryland legalized cannabis. One question that we will have a lot, I am sure, is, how did that change impaired driving? I don't have a good answer for that because we don't have a test for cannabis. We will test for alcohol on the roadside. We're able to test for that, and there's a law for per se 0.08. Obviously, blood alcohol content is illegal in Maryland. There is no same standard for cannabis, and a cannabis test is typically not done in a medical examiner's office, and it has to be requested to be done at the Maryland Police lab. So we don't have a good handle on how many folks were involved in crashes or were arrested. If they're arrested and they're positive for alcohol, they'll kind of stop testing there because we have the laws in place for alcohol. We don't have them as well for cannabis. So that's still a fuzzy area. We know cannabis use has increased. We've seen from trauma center reports that impaired driving with multiple types of drugs is on the increase. The last study they did was during COVID in 2020 and 2021. And polysubstance use is something we are definitely tackling. So what we try to do with our impaired driving task force, work with public education. We work with the Cannabis Commission to try to get those kind of messages out there. We are working with Bowie State, some other historically Black universities, colleges and universities to get onto campus to get that message across. Our Be the Driver campaign, which I hope everybody has seen by now, talks about highway safety and to make a plan for getting home. We've had the opportunity to have several grants with Governor's Highway Safety Association and Lyft. For the last several years, we've had $20,000 to provide ride credits that have been able to get people in all across the state home. We've used them around holidays. We usually have them at Thanksgiving and then again Christmas and New Year's. Typically, we have some credits left over that extend into the new year. I think we've used all of our credits for this year, but we did set some aside. We've got a special project going on in Prince George's County with some of the communities down there, working with bars and liquor establishments to still have some opportunities for lift credits to get folks home safely. We've had some other grant opportunities with GHSA. We've been able to train law enforcement officers for A-Ride, which is the opportunity that when law enforcement makes a traffic stop, it helps the officer identify impairment on the roadside without having to call a drug recognition expert, or even necessarily especially if they fail a blood alcohol breathalyzer test, they can still identify if they're impaired by other substances. We've been able to support Green Labs. If you're not familiar with what Green Labs are, you've ever seen the WKRP, I'm aging myself now, where Dr. Johnny Fever does the test in where they give them alcohol and they test their reaction time. They do a similar thing with cannabis. So they will use folks that are on medical marijuana. They'll bring them into a controlled environment. They will let them, it's called dose themselves. They'll let them use their cannabis. Right now it's through smoking, but there's other opportunities that also do it through ingestion and other ways. Then they bring law enforcement in to do the roadside test that they would do. So the idea is to train law enforcement to see what the percent of cannabis is in their systems, and to let law enforcement see just how cannabis affects reaction time, eye movement, balance, all the other things, so they can better identify it when they make traffic stops. In Montgomery County, Jamie Derbyshire is one of the national experts in conducting Green Labs. And so we're very lucky to be able to have that opportunity here. Chesapeake Region Safety Council also conducts Green Labs. They focus a little bit more on workplace use of cannabis, but still they'll include driving as well. Going into 2025, we will have a judicial outreach liaison in place. She is still, I think, a part-time Baltimore City judge, but she'll be able to help us with outreach to the judiciary, making sure that they're familiar with best practices when it comes to sentencing guidelines and what they'll see in testimony from law enforcement officers. We will also be, Dave Daggett has been our traffic safety resource prosecutor for years. He has retired to North Carolina. We will be bringing somebody new on board there as well. So these two liaisons can kind of work hand in hand to try to bring our courts up to speed and try to get more consistent outcomes when we take cases to court especially with impaired driving. We can see across the state that it varies in the adjudication, whether they're found guilty or whether they get PBJ. We'll also be taking a look at what the effect of closing of Noah's Law last year will have on impaired driving, that everybody that is convicted of arrested for impaired driving will have an interlock. They can't use a diversion like getting probation before judgment to get out of having an interlock on their vehicle. We provide lots of training. We've had a DUI for prosecutors, so we can train prosecutors across the state for them what to look for what best practices are. And as I said, we'll have the Judicial Outreach Liaison and the TSRP involved in all of these efforts, so we can make sure we're kind of setting the bar a little bit higher when folks are taking their cases to court. PB is Pedestrian and Bicycle Emphasis Area Team. We've also worked with them across the state this year to provide additional enforcement activities where they will actually go out and they will have folks, walk into a crosswalk and have law enforcement down the street for those vehicles that don't stop, and they can be pulled over and, given a warning or a citation, or just educate them about what Maryland's rules of the road are, and to make sure that they're looking out for pedestrians and bicyclists. It's one of the best enforcement opportunities that we have to try to drive the message home about how drivers should interact with pedestrians, especially at marked crosswalks. When we look at the data, we do see that a lot of our fatalities happen not at crosswalks. They occur where motor vehicle drivers don't expect pedestrians to be. So the area will not be lit. The area will not be, it's not a well-marked intersection. So lots of education to do there with both the drivers and the pedestrians themselves. Talk about new complete streets policy was mentioned earlier. What SHA is putting together, MDOT is putting together to improve areas where they've identified high injury networks for pedestrian injuries. Part of the pedestrian and bicycle assessment that we brought subject matter experts in from NHTSA several years ago to take a look at how we can improve our program for pedestrians and bicyclists. They encouraged local agencies to develop a complete streets policy. The state has it. They've also developed, asked local jurisdictions to develop highway safety plans. And I'll talk about that in a little bit. Cindy has mentioned that earlier this morning, that is something that Maryland is well on its way to doing. We are kind of getting our hands around plans that can help us set the path forward as we look to, how we're going to improve safety on the roadways. Outreach, Read Across America is coming up in March. We have Cheswick the Crab, who has made his migration from just Ocean City to the Western Shore. Cheswick will go around the state and be part of Read Across America. We have a talking car that's great for a cruise, is great for library events, elementary school events. It's great for pre-K, kindergarten, first and second grades. Cheswick is good for ages up to like fourth grade, but we're able to take these programs out to try to get messages out to kids and their parents about how to walk safely. I've had the opportunity to take crews to different events, and he's really well received. And apparently we get the kids talking about him for weeks after he leaves. That they'll ask questions about, where does Cruz live and how does, so it's really cool. So we try to model him on the way they do the characters at Disney. So nobody can see the handler, and then he just interacts with the kids. Taking a look at speed enforcement. Speed cameras have been up on 83 and in work zones. The law went into effect at the beginning of January, implementing a tiered work zone fine. We don't know, obviously we don't have results for that yet, but there is a bill in Annapolis already to move that tiered fine system to other locations as well, not just work zones. We do know that speeding is a huge component in our fatalities. They just released the FARS numbers this morning. They're not public yet, but they sent us a copy. Our impaired driving fatalities went down a little bit. They were 201 in 23. In 22, 23, they're down to 176. Speeding continues to go up. Speeding's taken its place. It's gone continuously up. Just over 200 of our fatalities were speed related. And of the 500 and of the just over 600 we had in 2023, that's a third of our crashes. So taking a look at speed, taking a look at impairment, all things we need to get a handle on as we move forward. We're looking at working with State Highway Administration for speed feedback signs, where they can put automated enforcement. Most of you are probably familiar with automated enforcement in Maryland. Work zones and school zones, they can go anywhere. If we want to put them on roadways, it has to go through the General Assembly to get them on other corridors. Taking a look at complete streets policy, which will help with setting the correct speed limits. They did review over the past couple of years, they reviewed 47 sites for speed adjustments. In 46 of those, the speed limit was reduced. That is one of the safe system approaches. It's a vision zero approach to be able to slow vehicles down. So if there is an interaction with a pedestrian, a bicyclist, or even another vehicle, the damage won't be as severe. Taking a look at seatbelt use, Maryland has been consistently above 90%. So when you take a look at all your fellow travelers out there, it should be that 9 out of every 10 of them should have their seatbelt on. We do an observation study with the University of Maryland in June of every year. It's right after we do the enforcement and the education wave of click it or ticket. So we do get a little artificially high number, but we've consistently been above 90% except for the COVID year of 2020. Last year was no different. 2024, our overall rate was 90.6. Although we are slipping down a little bit, there are still that 8 to 10% of people who are reluctant to put a seatbelt on. And there's most of our population out there now that's driving long distances and lots of miles has had a seatbelt law in place for most of their driving career. So there's not really a good excuse to do that. When we talk about people making mistakes that lead to crashes, we like to point out that the three things that I just talked about, wearing your seatbelt, driving impaired, and speeding aren't mistakes. Those are intentional actions that people take when they get behind the wheel. And that's where we're trying to point some of our efforts, whether it's through education, whether it's through enforcement, or whether it's through engineering means to slow folks down, make the vehicles so that they won't go into gear if alcohol is detected, make sure people wear their seatbelts. The local action plans, this started about the time that I started at the Highway Safety Office, which was 2018, making sure that the secretaries of transportation all wanted to make sure that, starting with Pete Ron, wanted local jurisdictions to have a local plan. So you can see over the past 6 years, this is kind of where some were in existence before that already. But you can see we've made a lot of progress in those 6 years, that there are a lot that are already implemented. There are a lot more that have expressed interest, and there are several that are in process. That there are only a couple areas of the state, notably over on the shore, that don't have plans in place yet. So everybody has worked to put one together. As we've said all along, we are happy to share the state's plan. And we're going through the process of developing it now. And there's a couple of jurisdictions that are on the same timeline that we are. But we encourage locals to take a look at their own problems, take a look at their own concerns, because at the state level, we do have to be all things to all people. So ours is very broad and we can't get in the weeds as much as we'd like. So it's really helpful to us to see everybody have drill down and start to take a look at their own data, take a look at where they can make a difference, because every difference that's made at the local level certainly makes a difference at the state level. So thank you for all your efforts. Last year's Vision Zero legislation created a public meeting. So my boss, Chrissy Nizer, is the governor's highway safety representative. I'm the Vision Zero coordinator for the state. The legislation asks that Vision Zero start to have public meetings. And as part of those public meetings, we will discuss the fatality infrastructure reviews. Our first test case we put on was the beginning of December. We reviewed 4 infrastructure reviews and basically used the Vision Zero meeting to replace our SHSP executive meeting. We will continue to do that as we move forward. The SHSP will be Vision Zero. Vision Zero in Maryland is really our strategic highway safety plan. That's, I said, the umbrella document under which we do everything to get us to zero. Then we will incorporate in those meetings a in-depth discussion of the fatality infrastructure reviews. I expect that number will go up so we can keep up with the number of reviews that they have. So I expect that each online meeting we'll be doing 10 to 15 infrastructure reviews, which aren't quite as far as the opportunity they talked about earlier this morning, but with a safety studio, but it's heading in that direction. And we are having multidisciplinary folks in the room to be able to discuss the crashes and what could have been done or what recommendations can be made to improve or to prevent those from occurring in the future. The next meetings are already on the calendar, April 17th, July 17th, and October 16th. Again, these are on zero-md.gov's webpage. We invite public comment before the meeting. We will be happy to address any questions during the meeting. It's still going to be a little work in progress through the first year, but the first meeting went very well. So hopefully we'll be able to continue what we're doing and not only just review the infrastructure cases, but also talk about what strategies we have going forward in developing the SHSP for the next 5 years and in what progress we've made. I'll wrap up with our Be the Driver campaign. It is multidisciplinary. I hope everybody's seen it. I'm not going to ask everybody to raise their hands if you have, because I always get disappointed when I do. So Be the Driver is it's really about the first time the Highway Safety Office has put together a comprehensive plan. So instead of having a different campaign tailored to occupant protection or seatbelt use or impaired driving or speeding, Be the Driver covers it all. So it's Be the Driver who saves lives is the overall tagline, but Be the Share the Road Driver be the make a plan driver, be the slow down driver, be the buckled up driver. So it's one consistent message is that we all want to be the driver that gets everybody home safely. So if you haven't seen the message, please be on the lookout for it. It's in Camden Yards. It'll be in Camden Yards again. We've had the opportunity to do public service announcements around work zones with both Cal and Adley. We've had sponsorships with the bobblehead, Adley's bobblehead at the Camden Yards. It's on the bullpen signs that you will see, make a plan. So keep an eye out for Be the Driver when you're out and about. Any questions, comments, complaints, suggestions? Yes.
Thank you for the presentation. I think the focus areas are all, very interesting. One thing I was curious about is enforcement between states, maybe. This is probably personal, but I know I was in a hit and run a couple months ago, and we got the license plate of the driver and everything, but because it was a Virginia plate, we couldn't really do anything about it. So I was just curious if you knew of any initiatives or anything tackling that focus area.
Not specifically related to that. I know there are some cross-state issues with regard to registrations and things like that they're working on. How law enforcement will works that way, I'm not completely familiar with. I do know that when we talk about enforcement and we look at kind of a tangent to your question, so our citations are down. We used to have well over 1 million citations a year back in the before COVID, before 2020, before 2019, 2018. Over 1 million citations issued a year for a variety of moving violations. We're down to 800,000 or so now. So there's a variety of reasons. Law enforcement is really one of our best tools in trying to get people to change their behavior. We can try to do a lot of different things through our media campaigns and going into schools and going into the colleges, but really law enforcement gets to the folks that are the most reluctant to change their behavior. Our goal is to get everybody to wake up in the morning and make the right decisions. But when they don't do that, that's when we need law enforcement to kind of back us up. So that's where we work a lot with them, but they've had a lot of issues over the years with manpower and just different things that are going on. So that's something that we try to make sure that we work closely with them to make folks aware that when we have messaging campaigns, we want to make it high visibility. That just everybody doesn't need to be speeding, doesn't need to be stopped, but we feel that when more people see law enforcement out there, that just having somebody pulled over on the side of the road makes a difference to more than the person that got pulled over. Even if they get a warning, everybody that drove by saw the red lights flashing on the side of the road. And that's not slow man.
Mr. Chair, we have a question from Hoy for Tim.
Yes, Tim, thank you for the presentation. It's very informative. I have a basic question first. Your MVA's strategic highway safety plan, does the plan cover local safety issues, local roadway, I mean, or only for the state highway?
The state's SHSP covers the state. As the map I showed, we encourage the local jurisdictions to develop their own plan because they can be very much more specific with what they want to look at. If for instance, a certain jurisdiction, whether it's a county or a city has a problem with young drivers, they can be very specific about young drivers. We have to be very broad.
Yes, I understand the law enforcement is a very good tool and important one, probably the key one. But moving forward, considering all the local budgets and state budget, and probably it's not getting anytime soon to improve the situation, to have more police on the roadway to give out the citations. So for education, and I think it's very important. And I know you have a lot of strategies and in your play, I mean, on your play already and all that. But recently, interesting, I've noticed that my sister Maggie, she just bought a new car a couple of weeks ago. And then she told me she's driving 80 miles per hour on the Route 70. I said, Maggie, you drive like a 60, 65 before. Why you drive at 80s now? Because the new car she bought is very easy to speed up to the 80s. She said everybody's driving 80s. She's so now the technology improved, the cars getting more easily to speed up and on the roadways and all that. So I'm wondering the education part. I wonder, I know this meeting is not the time to discuss the little details of the strategy, but coordination with dealerships and then let them to handle out the safety issue. And you bought a new car, don't speed, that speeding is very dangerous and all that. And that kind of education. And also for my personal experience, I found out the insurance company, if offer discount for people who go through the also sometimes very boring and time consuming 4, 5, 6 hours safety education driving, that could get you a discount insurance. And maybe state could partnership with insurance company to encourage more people to sit through those education. I know people knows those safety, but once you sit through it, you will reminding them time and time again. And that probably it could be a way. That's my personal experience. I like the discount, so I go through it every 3 years. Just I know those contents already, but I just want to like those discount. Just threw out some idea here.
Those are great ideas, because once you get your driver's license, and I can take a poll in the room. Once you got your driver's license, anybody going back to take a refresher and know what the new laws are passed in the last 20 years since you got your driver's license? Nope. So yeah, there's lots of opportunities for education out there, because once you get your license, you just have to go renew it in person to make sure you can still see the blue. Once every 14 years. So there is no refresher course that says, hey, this is the rule now. We do put, as new laws come into play, we do put them in the rookie driving handbook, and we do include them in driver's education, but that's the one shot that we have at folks. So trying to get messaging out is definitely something we need to work on. And as you said, there are insurance companies that not only offer a safety course, but they'll also offer you the fobs that you can put into your car that will track your driving. If you drive slower and safer, you'll get a discount. Lots of them offer those. But the other thing car manufacturers don't, or dealerships don't offer, is they don't tell you what your car does. So when you're driving down the road, they don't always tell you how your speed control works with a laser at the front to make sure you don't get too close to the car in front of you, why your seat vibrates when you cross the center line, why lights are flashing all over the place when you do certain things. It's really up to the drivers to do that. So we try to work in partnerships with AARP has a program, National Safety Council used to have a program to let people know what their vehicle does. And you're right, they do, the bigger the car now, the easier it gets to 80. And I was just at Transportation Research Board meeting last weekend, and one of the presentations started with, because we were talking about engineering, which is always one of the important components of highway safety, but they said, you show me a perfectly designed road, I will show you a human that can break it.
Right.
So that's where we are. About speeding, one thing that is going to come up in legislation this year is we have ignition interlocks for offenders for impaired driving. There is going to be a bill. I don't think it's going to go anywhere this year, but it's a start. There are governors available for vehicles for repeat speeders. So it can prevent your vehicle from going a preset amount over the speed limit. So that's something that's going to come up for repeat offenders for speeding. So more to come.
Good to hear that.
Chair, I think we're ready for final informational presentation.
Yes, now we're going to hear from Elizabeth Gordon, the Assistant Deputy Administrator for Planning and Programming at the Maryland Transit Administration. She'll update the BRTB on the current updates to the Central Maryland Regional Transportation Plans.
Hi, good morning. Hello again. So today I'm going to talk to this group about the regional transit plan and the update that we're doing of it. So in general, we're going to spend a lot of time talking about the previous plan, which was produced in 2020. The reason for that is that the fundamentals of the plan are intended to stay pretty much the same, and it's going to be an update based on hearing new priorities from stakeholders and also updates of the data and the analyses to make sure that things are current and still make sense. So in each of these sections showing the process and participation of the last plan, the objectives and strategies and the corridors, we'll talk a little bit about how those will play into the update, and then we'll lay out the schedule and the next steps that we can expect. So the regional transit plan for Central Maryland was produced in 2020. And what it was intended to do was to lay out a 25-year vision for public transportation in the Central Maryland region. It was meant to identify ways to improve MTA's transit, to better coordinate the transit region-wide and across transit providers, so MTA and the LOTS, the locally operated transit services. And it was also intended to sort of geographically show places and corridors that would most benefit from new transit infrastructure and service investments. And it was also meant to provide an opportunity and a venue to coordinate transit planning with local land use and other statewide transportation planning efforts to sort of bring everything into alignment. That plan was produced really collaboratively. It involved the formation and involvement of a commission specific to the plan. This was mandatory per the legislation and also really helpful because the meetings meaningfully informed the plan goals and objectives. They vetted our methodologies, and they were just opportunities to get sort of a truth check from stakeholders. One thing that has changed between the 2020 plan and now is that the Baltimore Regional Transit Commission has been formed by legislation, and they are now the body that will be the signatory for the plan update. So the majority of our involvement and vetting with a commission will be with the BRTC. We'll be presenting kind of similar information to this to them on Friday at their next meeting. In order to get that 2020 plan formed with a good wide view, our locally operated transit service providers, agency, local government representatives were involved regularly. And many of them are still with us on what we call the I team, which is an ongoing meeting to bring forward implementation of some of our strategies from the plan. There was also a lot of public engagement, a lot of investment made in public engagement in this initial plan. And that was intended to inform the priorities and the methodologies, but also really importantly to kind of set a durable baseline for that plan and its updates, because getting the public to weigh in meaningfully on sort of big, broad priorities, policy decision stuff, it takes a lot of effort to get folks to meetings. For things that less directly affect their communities, it's much easier to get people involved in a specific plan in their communities. So we really invested to get a sense of what the public needs and priorities were at the beginning, to stand on that foundation as we did updates. So there were 3 overarching goals that we came to and vetted through that process. And those were to optimize the existing services, MTA and the LOTS, to plan for the integration of the existing services with future services and future investments, and to enhance the fiscal sustainability. Those are big and broad, where those were sort of refined into objectives. Those came out as providing faster and more reliable service, growing ridership, an outcome of good service, a measure of good service, increasing access to jobs and opportunities, improving the customer experience, being equitable, and preparing for the future. So each of those objectives at that time had a bunch of strategies for its implementation. And one of the things that we've been doing in the early phases of this update is we've been looking back at those strategies and taking stock, have we accomplished them? And of the 34 strategies, 7 have been completed and others are in process or they're continual commitments. The strategy may be something like focus on equity in your service planning process, And we do that every year, and we update our methodology of how we do that yearly. In terms of involving the BRTC in the update, one of the first things that we're going to be asking them is considering the objectives and the strategies for update and addition. So that's one of the ways we'll be sort of iterating the plan for the update. Additionally, as I said, another thing that the 2020 plan did was it identified these geographic locations that were ripe for investment. And that came to be the 2020 RTP corridors. And those were broken into the early opportunity corridors. So these are places where there was a lot of demonstrated demand for transit, and various other factors meant that it was the judgment of that plan that they could be places where you could invest quite soon. Midterm opportunity corridors, similar thing, a lot of demand, but perhaps there were obstacles to investing right away. And then those long-term corridors are places where we're maybe seeing growth, seeing need for transit services, but there may be connectivity challenges or something else, meaning that that's more of a long-term investment goal.
I have
Yes,
a question.
of course.
So with the mid, long and short-term opportunities,
Mhm.
would these all have to be implemented by MTA or could they be implemented by lots like RTA, for instance?
Yeah, so for instance, one of our early opportunity corridors, corridor 27, was that Ellicott City to Silver Spring corridor, right? And so MTA is not the appropriate implementing agency for that. And I think one of the important things to think about in terms of a region-wide plan is MTA certainly has an important convening role and an important funding role, but we are not the only transit provider. So one of the corridors where we've already made progress is that Flash BRT in Howard County, and that's not an MTA service. So thank you, great point. Yeah. In addition to some specific projects like the Flash BRT, the development of and relaunching of the Red Line and the Raise East-West Bus Improvements Project, those are all early opportunity corridors that have evolved into specific projects. There's also been analysis conducted on some of our mid and long-term corridors. So the North-South feasibility study, the East Baltimore County access study, and the BWI to Columbia pilot feasibility study, another partner project. Those are all places where groundwork is being laid for these mid and long-term opportunity corridors. So what are we gonna do in the update to relook at those corridors? Basically, we're going to refresh the transit demand analysis. Things really haven't changed super drastically. I know 2020 feels like a million years ago and like everything is totally different. And in some senses, that feeling is totally correct. But when you're looking at the data about where people are living, where people are working, how much they're driving, things have changed around the margins, but not fundamentally. So we're gonna try to understand where those changes have occurred by looking at demographic and economic data, where the job's gonna be now, where's the housing gonna be now. And we're also gonna be looking at the transit schedules and operation data to really get a whole picture of what the transit market looks like now. How well does the current transit serve both existing and latent demand, and what places and time periods need new or more transit service? Some of the ways that we look at this in a data-driven manner is looking at where the populations of people who are very likely to use transit live, and also where they work, where they're going to. So some of the components of that index are household income, disability status, vehicle ownership, and just pure population density, right? And so we're gonna be updating some of those indexes to look at where some of those patterns have changed. You can see here that there are these places shaded in purple where some moderate increases in transit propensity have occurred. We'll also be looking a little more specifically than those big aggregated index at employment projected growth, because we know that serving people at their homes really only serves one end of the trip. We also need to figure out where people are going. Some of that is really just short trips within their communities, but some percentage of people's trips are getting to work, and that's a key one in their residential location selection and in their employment location selection. So we really do want to make sure that we're serving the existing and growing job centers. Additionally, there are other factors that we have looked at, which are the density and growth of population, the density of the employment in other locations, the actual travel flows using various kinds of big data, probe data to look where people are going, the existing transit service in terms of how successful it is in generating ridership, how much it has grown in a given location, or perhaps the opposite of grown. And also the existing transit frequency and span of service, how often the transit vehicle comes, how late at night you can take it, that sort of thing. And we look specifically for some destination types on the maps and in relation to our transit service, employment, retail and restaurant, healthcare, social assistance and other institutions, education, government services, that sort of thing. One of the other things that we'll be discussing with the BRTC is if there are other factors or changes that are really of interest in terms of updating the analysis. What we intend to do to get this plan updated by October, which is our due date to get it updated, is in this period right now, we're documenting the progress on the strategies, we're updating the market and demand analysis. And then in the spring, we're going to be using some of that analysis to confirm and prioritize the RTP corridors, see if there's anything we missed, see if any of these corridors need to be moved in their short, medium, and long-term priority. And also we're going to look at the characteristics of those corridors and assess from a kind of engineering feasibility standpoint, high level, what kind of transit mode could even be feasible and appropriate in those corridors, just to have that information. In the summer of 2025, there are some parts of the plan that are very likely to be proposed service improvements as opposed to big infrastructure investments. We're going to be developing and prioritizing those. And then also, as I mentioned before, incorporating that feedback to update what the strategies are for implementation. In the late summer, we're going to be drafting the update document, vetting that through the BRTC, and then finalizing the document with their input in time to publish the adopted plan in October. The next steps, immediately refining those results of the market and demand analysis, beginning the corridor confirmation and prioritization process, incorporating that input, and then presenting those final results at the next couple of meetings and getting feedback on our approaches to some of those next steps that I described. With that, a lot of info, but I'm happy to take any questions or to clarify anything.
Very good. Is there any other business to come before the BRTB?
Mr. Chair, we would like to ask Mr. Jeff Anderson from the Maryland Department of Transportation to just give us a quick briefing on a General Assembly bill related to the project prioritization process that was presented at the November BRTB meeting. Jeff, are you able to talk a little bit about the bill, please?
Yeah, happy to do that, and apologies. We'll see if my voice will last as well. The CTP is due tomorrow, where I'd be there, except for the fact that I'm also a little sick. I think those two are probably related. So Todd, is there ability to share my screen here, or should I just speak without visual aids?
Second, please. Fortunately, I don't believe I can make you a co-host. We're going to see whether or not Regina might be able to do that here in a second.
Okay.
Here we go.
Done, girl set.
All right. Hey, miracles will happen. All right. So I think we have talked about prioritization before. So this is House Bill 20 that's bringing that into legislation. There are a couple other things that have also been included in the bill. I'm going to give you kind of the highlights here. It is a 36-page bill. So there are little details here and there, but I think I've captured the major things. Highlights, main thing this bill does is update the current Chapter 30 prioritization process. I think, as you all know, this is something the Train Commission recommended to us. This is something that we really view in line with Governor Moore's priorities to be data-driven and heart-led. That's, to me, what prioritization is all about. I've listed kind of some of the key details about that update. And then there are a couple other sections of the bill that really are about the Maryland Transportation Commission, updating the makeup, the chair, the frequency of meetings, and sort of defining a little more some of their duties, and then a brief section on asset management. So let me just kind of run you through in a little more detail. So updates to Chapter 30. These are some of the big updates in my mind. It does put capacity improvements on a biennial schedule. So rather than every year, we'd be putting out an amount of money, an explicit amount of money available for capacity improvements on an every other year basis. We'd be announcing that before the funding round goes public. We'd create an online portal. There is a Chapter 30 online portal. We've amended that for applications. There's also a provision to create a separate online portal for local priority letters and to give some more guidance on what priority letters look like. And that's in part because MDOT receives a lot of different priority letters. Some are a page or two long, some are 20 pages. Sometimes the priorities are clearly bulleted. Other times they are embedded in narrative on page 14. So this is trying to make this a better format for both localities and MDOT to be able to use. It does expand the eligibility of entities that can apply to have projects ranked and scored. And that expansion is to MPOs and transit agencies. It adds some transparency provisions. Really, this is one of our big goals, is to make just the process more clear to potential applicants, and to have a very clear link between the ranking process, where projects get ranked, which ones get funded, and how they ultimately end up or don't end up in the CTP. And I think a lot of that is very vague to people right now. And then along the lines of data-driven and heart-led, really trying to be explicit about what the goals are, and then using data and analysis to evaluate that. I will note the goals on the left side, safety, accessibility, and mobility, and so forth, those are specified in the legislation. These measures are not. These will look familiar to you if you were in any of our pilot round briefings. This is what we have at the moment. This does differ from the Chapter 30 legislation, where the actual measures are specified in legislation. So this gives us the opportunity to update measures over time as we learn more about the process, as we learn what's working and what's not working. It also represents a reduction in number of measures. I think there were over 20 measures in Chapter 30, and this brings it down to 11 in an attempt to just sort of make it clear how the system works. Just to remind people, it's really, I think, a three-step process that we're looking at in terms of projects getting into the CTP. The first step really being about getting the project scored and ranked. And so you have projects 1 through 43. It might be that the available funding in that 2-year period allows for projects 1 through 20 to be funded. Those would be published in the CTP. And actually, I think in the legislation, it requires us to make them public August 15th, but they would go into the draft CTP. We would do the CTP tour and get feedback. And then there is the opportunity for the MDOT secretary to make changes to those projects. But any changes would have to basically be laid out to the Transportation Commission at a public meeting with an explanation of any project substitutions from the original list. This gives you a quick overview, and I'm not going to go into a lot of depth of basically the cadence of the 2-year process here. The short version is the portal for applications would open in January, and indeed the pilot round is opening tomorrow. So if people are thinking about submitting projects, you'll be able to do that starting tomorrow. The portal closes February 18th this year. We would do scoring essentially between then and May. We would, as I said, publish the results of the scoring in the draft CTP and a little bit before, get public input, go to the Transportation Commission with any changes in December. That final CTP would go on to the legislature, who would do what they do to the CTP, get it approved. And then in that second year, rather than restarting that process, we'd be essentially looking at evaluating the prioritization process, working with our stakeholders to see if any changes need to be made, looking for better ways of measuring outcomes, seeing if there are better data sets, and then ultimately updating the process, again, sort of announcing those updates to the Transportation Commission, and that would restart the whole process. I think the two major other kind of focal areas of the bill are the Transportation Commission. The bill restructures or proposes to restructure it, and identifies at least quarterly meetings. You can see how the membership would be formed from there. 13 total members. It identifies the powers and duties of the commission, and those are currently quite broad anyway. And so this is kind of in some ways I guess just kind of adding some specificity, saying make sure you do this in addition to basically anything else you want to weigh in on that's transportation. But you can see we would use that as a place where we could take our quarterly operating and capital budget updates. I think there's a feeling within MDOT that excuse me, that some of these some of the changes that have taken place between, say, a draft and a final or over time come as a surprise, because there's a longer window where things are evolving and changing, revenues, costs are being updated without kind of an external venue where that information is being shared. So we're looking at that as a way to do that, just to give people a better sense of kind of what things are looking like with our finances. And then using it as a place to really focus our external work in the prioritization process, as I said. And then finally, for the every 5-year update to the Maryland Transportation Plan, an opportunity to weigh in there. There are some additional small pieces about that in terms of additions to the transportation plan. And then asset management, and this I view as largely codifying existing practice. MTA and SHA both have federally required asset management programs and ranking systems. And then since about 2018, we as a department have been working to improve our asset management and go beyond what's required at the federal level. You can see, a lot of the things here are really, I think, taking the actions that we've been taking and trying to make sure that with future administrations, we don't backslide. We continue to make sure we understand the condition of our assets, that we are using good projections to understand where they're likely to head, what the likely life cycle costs are, when ideal moments are to make system improvements to minimize life cycle costs. There is, I think, a new provision in that last bullet that's trying to look at a 20-year period for pavements and bridges. We'd like to be able to look a little further out and make sure we have the full sense of the life cycle for those assets, and then applying a kind of appropriate targets to in terms of timeframes for other asset classes. So that's a quick overview, and I'm happy to take any questions and appreciate the opportunity to talk to everybody about it. Thank you.
We do have a question from Sam Sneed from Anne Arundel County.
Hi, thank you for the presentation. I have a question regarding the criteria. In the past, counties and jurisdictions that have provided significant match or overmatch for projects on this list have had greater consideration. Is that a subjective criteria not listed? Or is that being removed?
I'm sorry, it was a little hard for me to hear, but I think you were asking about when localities are contributing money, match or overmatch. One thing I neglected to say, just in the interest of time, is that after receiving a score on all of these measures, these scores are divided by the cost of the project. And so that is a cost basically to the state. So any matches provided by localities effectively reduce the cost. So a smaller denominator basically makes you score better. And that actually has a pretty significant impact on scores, the cost of the project. Does that make sense?
Yes, thank you.
Yes, we have a question from Tony Russell from Baltimore County.
Yeah, Jeff, some of our past projects, the funding was deferred on our CTP. Do they go to get evaluated again, or I know there was talk about a letter stating that we still would like interest in some of these projects moving forward. Specifically, I'm talking about 795.
Yeah, so that's a great question, Tony, and one that we're still sorting through. Here's kind of how the buckets work in my mind. If it has been scored with Chapter 30 before, but has not really received any funding to this point, then it definitely needs to be scored again. And we have sent letters or emails out to folks saying, hey, if you have a project that's been scored before, it needs to be scored again. But good news is you gave us a bunch of data before, so we don't need you to go through the whole process. Please send us, your desire to have it scored, and we'll tell you what data we're missing. So we're really trying to not have people have to duplicate previous submissions for Chapter 30. That's the first bucket, is basically it hasn't received any funding in any CTP in the past. Second bucket is there are projects that are, basically in construction. Those are just going to go forward. And then we have the projects that have received some level of funding in previous CTPs. And frankly, we're working through that right now, Tony, to figure out exactly which ones, how far into the process we're saying, that's going forward, and which ones might need to be submitted again for scoring.
Great, thank you.
And I think I mentioned, I hope I mentioned that this pilot round is a zero funding round because of the fiscal situation we found ourselves in, and because of the number of projects that have been deferred in the past, and just feeling like they're, in terms of any resources, we do not have resources at this point to bring in new capacity projects. This is a zero funding round and is really meant to allow people to become familiar with the process, see if they have all the kinds of data they need to submit projects, to allow us to kind of ground truth the project's scoring system, to work with folks like you all to make sure it's working, the whole system is working well, and then we will have the system ready to go once funding is available for new capacity projects.
All right, well, thank you very much, Jeff. We appreciate this. Again, General Assembly is just starting, so we, BMC.
Todd, I know I owe you a response to your email with that timeline question. I will hopefully get to it later this week.
Not a problem. We understand you were busy. And we hope you feel better.
I appreciate that. Thank you.
There, we have no additional business for the BRTB.
Hearing none, call for a vote to close the meeting. All in favor, say aye.
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 Our next meeting of the BRTB will be virtual and is scheduled for February the 25th.
Also like to welcome the new Baltimore City Director of Transportation. Thank you, everyone. Have a good day.